One blood, one fight, united against sickle cell disease. Hi, good day. I am Famibere. Welcome to another conversation with me. Today, we're here to talk about sickle cell disease. Sickle cell disease is a group of inherited blood disorder whereby the red blood cell, which is usually round and flexible, changes to a shape of a sickled or crescent moon. These abnormal cells can get stuck in blood vessels, thereby causing or restricting blood flow and causing pain. It's a lifelong disease that people are born with. A brief history. Sickle cell disease was first described in 1910 by Dr. James Herrick. He noticed sickled shaped red cells in the blood of a patient from the Caribbean. Over time, it was then understood that it was genetically inherited. For signs and symptoms, here we explore sickle cell crises like joint and body pain. We explore fatigue, weakness, swelling in the hands and feet, delayed growth in children, yellowing of the eyes and skin, vision problem, recurrent infection, and even in severe cases, stroke. Under diagnosis, we explore sickling tests, genetic testing, complete blood count, hemoglobin electrophoresis tests, and also we can explore the newborn screening. These tests confirms the presence of sickle cells in the blood. Under clinical presentation, we explore jaundice, pale skin and mucosa, we explore splenomegaly, we also explore leg ulcers, and in extreme cases, we explore chronic organ damage. That we talk about damage to the liver, damage to the kidney, and also damage to the heart. Under differential diagnosis, we talk about ailments that are confused or that mimic sickle cell disease. Here, we explore ailments like iron deficiency anemia. We also explore autoimmune hemolytic anemia. We also explore leukemia and also osteomyelitis. These ailments often mimic the presentation that comes with sickle cell anemia, but the distinguishing factor here is that there are no sickled cells. For causes, the cause is genetic. It is usually caused by inheriting the sickle gene from both parents. Risk factors are family history and ethnic background. Under treatment and management, here we explore pain reliefs like the NSAIDs and the opioids for extreme sickle cell crisis. We also explore bone marrow transplant, hydroxyureas, pain meds, folic acid, penicillin prophylaxis, vaccination in extreme cases like meningococcus and even the influenza vaccines. We explore blood transfusion, hydration and oxygen therapy. These treatments and management help to relieve the crisis that comes with sickle cell disease. For prognosis, it can be chronic but manageable with proper care. Early diagnosis, preventive care, and access to treatment improves the outcome. Complications can reduce the quality of life and also the length of life, but with proper care, it can be cut out. These complications like stroke, organ damage, and even recurrent infections can reduce the quality and the length of life. It's very important to note that sickle cell disease is caused by genetic traits from both parents. Therefore, parents that are non-compatible should ensure that they avoid this disease by sticking to the right marriageable or sexual partner to avoid bringing children that suffer from sickle cell disease and therefore go through pain and lifelong crisis and therapy throughout their lifetime. Thank you so much for listening. I remain Famibere. See you in the next video. Bye.